Welcome, everyone. Thank you for joining us on this early Sunday morning. I have a special guest here with us today, Dr. Lieske. And Dr. Lieske and I met through a mutual colleague in the medical profession, and we connected with a business networking group and then had some follow-up calls, and I really enjoyed what he had to say, and his passion to help people is really outstanding. What I want to do is bring in Dr. Lieske today to answer and to talk about some of the main concerns that we have in the middle of this COVID crisis. We are all very concerned with improving our health, our wellness, and looking at ways to fight some of these diseases that afflict us and can make us, potentially more vulnerable to various viruses, not just COVID, but other viruses, pneumonia, other things out there. So we have Dr. Lieske today, and let me tell you a little bit about him before I let him join in. So he he's here in the Phoenix area, and he went to ASU. Yay! Went to ASU, and he even got his degree in exercise and wellness, and he even went into the Marine Corps for about 4 years. So thank you for your service. We all appreciate all of our service members, and we know that's a hard job, but after his service, he finished his degree and then got his doctorate at the Southwest College of Naturopathic Medicine here in the Phoenix area. And one of the reasons I'm bringing him in here today is he has a variety of interests and passions for helping people in a naturalistic way. And one of the things that we want to talk about are some chronic diseases. And I know that one of his passions is diabetes prevention and management, looking at cholesterol and then even weight loss. And then he has a variety of other things related to hormones and men's health. But we're going to make this a little bit more on the general side so it can affect men and women today and some of the things that we need to learn. So, Dr. Lieske, thank you for having us. If you wouldn't mind sharing a little bit more about any of the details of your life that you want to share with us, and then we'll get started.
Awesome. Thank you for having me, Dr. Novotny. It was a pleasure meeting you. I'm so glad that we met through a mutual colleague and got to know each other, and it's great to be here. Thank you for having me. So I was really lost as a kid, 18-year-old kid. I started college. It just really wasn't for me. I wanted to do something difficult and hard, and that's where I jumped into the Marine Corps. It was the hardest thing I could think of doing. So I did spend some time overseas. I got to see the world, whether it was in Japan. I spent some time in Japan. I also went to Iraq. So I came back, and I was much more aware of the problems throughout the world, and especially the problems here. When you go and you see the epidemic of obesity here compared to those in Okinawa, Japan, where I was stationed for a year, it really has a big impact on you, just noticing the change. So I came back from the military. I finished my degree. And then it was actually there in my undergrad at ASU where I met my wife. And my wife was going to a very similar program, but her program was a little bit different in the sense that she had to take an alternative medicine class where she learned about acupuncture and chiropractic and multiple different modalities. The fact that herbal medicine is used to this day, things like that. And upon our graduating, she kind of wanted to jump into that field of naturopathic medicine and become a naturopathic medical doctor. She was just a little hesitant, right, to actually pull the trigger and apply and things like that. So we made a deal, and we would apply together. And if we both got in, if we didn't both get in, at least we did it together. And that was something that kind of helped build our relationship. And turns out we both got in. So we were both accepted. We both did the 4 years of medical school. And now in 2018, that's when we graduated. We got our licensure after 4 days of strenuous testing and things like that. It was pretty intense. But once we got through that, we were building our practice, and we opened our doors October 1st of 2018. And it's been fantastic ever since then. It was something that, I was never a guy that really liked or enjoyed school. But when I got to my second year of medical school, we actually start interacting with patients and things like that. That is what I loved. That's where my passion really started and grew as a physician, because it was at that point that I could see the change that I was making in people, and knowing that I was able to help people live better lives, live longer lives, be able to see their grandchildren. And I'm never looking back, right? So this has been the best time of my life, and helping people has been fantastic. And I
Yeah.
hope that was a decent explanation of my
Perfect.
past.
Absolutely perfect. And it just shows us, we can see in you how much you enjoy helping people. And it's exactly what, why I got into healthcare as well. It's just, there are so many people out there who are hurting and suffering, and
Mm.
we just need to meet the right people to help us get onto that new path to help us heal. And so it's one of the reasons why I wanted you here today. And can you explain to us, a lot of us come from a traditional medicine approach. You see your primary care physician, you are just used to that. I grew up, that's all I did. Anytime I had an ache or pain, my mom would take me just to a primary care physician, family physician. It wasn't until I was older, really searching for alternate methods of physicians out there who don't use chemicals, because I'm very, very much in terms of non-synthetic things. I really appreciate what's out there in the natural world, and I know a lot of people are unfamiliar with the naturopathic physician. And so can you just explain the practice a little bit and kind of what the approaches are, any thought processes, how it's different, anything like that?
Absolutely. So, yeah, there is a lot of confusion, and each state is actually regulated a little bit differently for a naturopathic physician. Arizona is one of the best states because we have a very broad scope of practice. And we have a lot of prescribing rights and things like that. So let's start at the beginning. You have to apply. It's just like a medical school. You go to a 4-year institution where you're doing an equivalent of around 120 college credits each year for 4 years straight. So it is intensive medical school training where you take all of the same classes: biochemistry, anatomy, physiology, pharmacology, all the same classes, but then we take additional classes. So we're learning beyond pharmacology. We're taking botanical medicine. We're taking acupuncture classes to better understand that. There's just physical medicine modalities, so we can actually manipulate similar to a chiropractor, things like that. So we have a very broad scope. We have lots of tools in our toolbox, but one important one that does kind of change us from some other types of physicians is we can prescribe. We can order blood work. We can draw your blood. We can order imaging, things like that. So very similar to what you are already used to, just our approach is slightly different. So for example, if you have a small infection, right? You have a cut on your arm and it hasn't quite gotten to an infection. Maybe we can use an herbal topical supplement or something that we can apply and hopefully knock it out before it becomes systemic. But one thing that we focus on is never being dangerous, right? Safety is always a priority and a concern. So if we have to use antibiotics, we will. That is something that that is very confused, is that we're anti-antibiotics, we're anti-vax, or whatever the case may be. It's not the case. We're just trying to bridge the gap between natural medicine and the standard conventional medicine of MDs and PAs and NPs. So another example I like to use is diabetes. Typically, the standard protocol for diabetes is, they might refer you to a registered dietitian, but then they'll just kind of wait until your diet continues to be bad, until your numbers, your hemoglobin A1C and the blood glucose continue to get worse, and now you're pre-diabetic, and then they just put you on of metformin, which is the standard drug that you start a diabetic patient. We as naturopathic physicians would typically take that a different way, right? We'd institute maybe some minerals, maybe some herbs, but most importantly, dietary changes, exercise changes, things that can help reverse some of these trends towards diabetes and kind of knock it out before it gets bad enough that we have to use medication, because medication is not the goal. It might be what's needed, but it's not the goal.
Right.
So we have the ability to prescribe many things, just like your primary care. There's a lot of naturopathic physicians that do primary care that you could just convert. I don't want to say convert, but switch over to a naturopathic physician as your primary care physician. And then some of us specialize. I focus a lot on hormones and metabolic health. Metabolic health is a broad term. that kind of encompasses multiple conditions that lead to metabolic syndrome and metabolic conditions. So that's kind of inclusive of diabetes, cardiovascular disease, which is issues with your cholesterol and lipid panels and things like that. Obesity is something that puts you at risk for multiple conditions, including diabetes, including cardiovascular disease. So with all of our new patients, we run a hemoglobin A1C, which I know that's a vague term, but it's essentially looking at your 3-month blood glucose average to see where you're trending towards diabetes, if you're pre-diabetic or diabetic. So, because I want to know right when I first see you how you're doing it, because I want to nip it in the bud if I can. We also have a lipid panel that's included with our new patient appointments that's evaluating your total cholesterols and your HDL and LDL and triglycerides. So if there is changes needed, that is included in your treatment plan, even if that's not what you come to see me for, because it is important.
So now let's talk a little bit more. Can you explain, I've heard the term metabolic syndrome, and I know there's certain criteria for it, but for anyone who's not listening or who's listening who isn't quite familiar, what exactly do you mean by metabolic syndrome? And then what are all the pieces to it? Why don't you explain that if you don't mind?
Sure. And metabolic syndrome is there are criteria such as blood pressure and waistline type things. The fact is that it all goes together. If you're eating healthy, if you're exercising, you're not going to be at, trending towards obesity. And your insulin sensitivity, which is something where you eat a bunch of glucose, a bunch of sugar, carbohydrates, if you're eating a ton of that, your insulin needs to create more and more insulin. So you get resistant to that insulin from functioning properly. And that leads to more weight gain. It leads to things like diabetes. So metabolic syndrome is a term that's used quite frequently, but essentially we're just trying to avoid getting to the point where we have all these different conditions like diabetes, cardiovascular disease, atherosclerosis, which many people are put on statins because they're trending towards atherosclerosis, which can lead to heart attacks and strokes and things like that. We're just trying to reverse that and kind of catch it before. And one thing that I just had a patient the other day that he's in his 30s, and he said, well, thank you for taking care of me. I appreciate it because I want to be able to see my daughter grow up. And one thing that I like to emphasize is it's not about your daughter necessarily. It's about seeing your grandchildren, right? Like we're in this for the long haul, and we got to fix this now, catch it early before it becomes a problem, because you want to be there for everybody, for all of your family, including your grandchildren. So.
Absolutely. So now we've touched on diabetes a little bit. There are multiple types of diabetes, and I've seen clients where I ask them, what type of diabetes do you have? Is it type 1, type 2, and what are some of the details of that condition for you? And sometimes they're not always told that. So can you just briefly touch on the different types and what you would do in terms of someone came to you with type 1 or type 2 diabetes?
Sure. So yeah, they're very, very different. And it's frustrating because that is a very common thing that people come to us, either trending towards diabetes, type 2 diabetes, and they don't even know what that means, what's happening inside of their bodies. Type 1 typically happens at a lot younger age. It's where your pancreas just doesn't create enough insulin. So you have a buildup of sugar in your bloodstream, and there's no way for you to get rid of it, essentially. And so that's when you have to start doing the injections of insulin. Type 2 diabetes is completely different. There are things you can do for a type 1 diabetic, reducing carbohydrates, things like that, but it has to be monitored safely, because you could very easily get in a dangerous spot with type 1 because there's just no insulin whatsoever. Type 2 is very, very different. This is a slow progressing thing, typically happens in older individuals. As they continue to have poor diets, it leads them towards a point of insulin resistance, meaning that more and more insulin must be produced. At some point in time, your body will produce so much that it's kind of hit its maximum capacity to create more insulin. So, I mean, there's many drugs that do different things for type 2 diabetics, whether it's trying to tell the pancreas to create more insulin, whether it's trying to tell the liver to release less blood glucose to hopefully lower your total numbers over time. The point is that we need lower blood sugar, and so that we need less insulin. everyone talks about the ketogenic diet and things like that. I don't recommend this for diabetics. It can be a good, useful tool, but it's something that can be changed with just a low carb diet rather than going full on out on a diet that you can't really consistently keep up with and things like that. It's a very hard diet to maintain. And when you have a lower carbohydrate diet, you're then going to have a lower amount of insulin needed. And that's where you can kind of pull back some of that resistance and hopefully reverse the trend towards diabetes. Type 2 diabetes can get worse. And the conventional theme is you start with metformin and then you add another type of drug and then drugs. And then eventually you get to a point where the oral drugs are no longer effective. Yeah. Because you're not changing your diet, you're not changing your exercise. And it will just progress to the point where now you need to give yourself insulin. And it's a long-acting insulin and a short-acting where you're checking your blood glucose 2, 3, 4 times a day. That's a lot of finger pricks. And I don't know about you, I don't like pricking my finger even once a day. So it's something that can be prevented. And unfortunately, a lot of the nutritional training, clinical nutrition is not taught to conventional physicians. And many physicians are taking it upon themselves to understand these things and take additional biochemistry classes. That's one thing that our industry, the naturopathic physicians, really shine at, because we actually get 2 years of clinical nutrition. It's very in line with like a registered dietitian might get that much training and biochemistry. So we really understand the body and what happens with these diseases so that we can better alter and modify dietary programs, exercise programs, those types of things.
Now, one of the things that I hear often is when people say, oh, I have to get rid of my sugars, I can't eat carbs, they loop in fruits and vegetables. I know obviously fruits have higher levels of sugar in terms of spiking your blood sugar, but there is fiber that helps mitigate that a little bit. What do you tell your patients when they come in and say, well, I have to get rid of all my sugars and carbs, and they want to say, okay, no fruits and vegetables? I mean, there's so much evidence out there that eating plant-based can actually help with a lot of chronic diseases. What's your recommendations, just generally speaking, in terms of diabetes and like a plant-based diet?
Yeah, absolutely. So definitely any added sugars we want to remove. That's for any person, not just someone trending towards diabetes. It's very easy to overdo the sugar in this age of soda and candy and this surplus of processed foods everywhere that we look. As far as fruits go, I think fruits are very necessary. They're something that they're nutritious, nutrient-dense foods full of different antioxidants. You get different colors, you get different nutrients. They're awesome, but you can very easily overdo things like fruits. I'm actually creating a handout right now that I'll be having on my website within the next week here. And it's talking all about blood sugar and how you can kind of find those hidden things, many things, including things like kombucha, which, in the natural community, we think, oh, kombucha is really good for you. It's good for your gut microbiome, things like that. But you have to think about how it's made. This is using a bacteria that needs to feed off things. So typically you're adding sugar, you're adding glucose and these types of things to feed the kombucha. So if you buy them in a store, things like that, they're going to have quite a bit of sugar. People see juices as alternatives to fruits, that they would, have a lot of vitamin C in orange juice, things like that. While they can have some nutrients, they are very high in sugar. Some even have added sugar. It's incredible. And when you juice something, especially pressed juice, things like that, you're actually removing all of the fiber, all the things that slow the metabolism of that sugar into your body. And then you're still spiking your insulin when you have these juices, things like that. And then there's the more obvious ones of sodas and things like that. So I think I typically never recommend people don't eat any fruit. Fruit is actually metabolized in our body through different chemical processes, differently than just normal sugars. Yeah. But you can overdo it very easily. Okay. Absolutely. I always like to think of kind of the caveman days and things like that, where we, kind of created our biochemistry. Back in those days, we would be walking through the forest or wherever, and we'd stumble across a patch of berries, right? And we'd eat them all up, and then maybe we wouldn't hit those berries again, and another patch of berries for a week or two until we stumbled across them. So that's kind of like how I see it as you get the nutrients from them. Yes, you could probably have them every day, but having a all fruit diet, having 10 servings of fruit a day, it's easy to overdo and be just as bad as some of these processed foods with added sugars.
Yeah, I appreciate you touching on that because it's a question I get very often. So it's good to have someone who's had the background in studies to address that for us. One of the other areas that I think is important to talk about, especially now, is cardiovascular health. And can you touch a little bit on cardiovascular disease? What does that encompass? What does that mean? Atherosclerosis. A lot of that term is thrown out there a lot, but we often don't hear the meaning in layman's terms, just discussing it. So
yeah, absolutely. So cardiovascular disease is the biggest culprit right now in America for deaths, is heart attacks, strokes, just overall cardiovascular disease. Most are a result of atherosclerosis, which is a buildup of plaque. Typically, it's multiple different things. It's different blood cells. It's calcium that builds up. It's cholesterol is one of the one that's most the biggest impact to atherosclerosis is cholesterol. So the point is that the biggest risk factor for any cardiovascular disease is age, but we're living a lot longer now, right? So that becomes something that we have to address, because previously, when hundreds of years ago, if we only lived to a ripe age of 30 or 40, some of us wouldn't be dying from cardiovascular disease. But now that we're living to their 70s, 80s, and even 90s, for most of us, cardiovascular disease is a big component to the reason why we might be dying. And my goal is to try and fix that and catch it early so it doesn't become a problem. So atherosclerosis is essentially a plaque buildup of cholesterols, and that's why your PCP or your primary care physician, they run things like lipid panels starting at around age 40, depending on your family history. We'll start even at age 20 if your family has had multiple deaths, or if your father had a heart attack at a young age, things like that. A lot of times the younger deaths are a result of familial dyslipidemia. So it just means that you have a genetic predisposition to having higher amounts of cholesterols that leads to early plaque and things like that. So we can start the testing as early as age 20, just to make sure that you're good. And then we continue on. And what we're finding a lot is that the testing, the standard lipid panel is awesome. You can look at the HDL, the LDL. LDL is considered the bad cholesterol, because it has the highest density of cholesterol, and there's more LDL than most other components in the blood as far as lipids go. So those are the ones that are going to get stuck and create that calcium buildup. You also have to have inflammation, right? So leading a healthy lifestyle where we're not taking in a bunch of sugary things, that can help from this atherosclerosis kind of being built up. And so when we do these lipid panels, what's really great is we can see where you're at and then see the progression, see the change that happens from these dietary changes. And that's helpful to actually continue and keep moving forward with our dietary changes. There's also more advanced testing that most physicians don't even know about. And that's my passion, is trying to get that information to the public. There's a test called the NMR lipo profile. And it's not well used because physicians actually don't know how to read it. And what this does is it breaks these components of the lipid panel down more specifically to the amount of LDL particle size, not just a calculation of the LDL, the amount of particles, because if there's more flowing through your blood, then you're going to have more odds of them getting stuck and creating this atherosclerosis. There's also a test called a calcium score test, and it's essentially a CT scan of the arteries and blood vessels of the heart, and it can actually evaluate whether there's calcium seen on the image and tell you right then and there if you have any indication of disease process going on. And these tools are very helpful at really digging beyond the standard lipid panel, and finding out your risk and how aggressive we need to be. Because my goal is not to put you on a statin, it's to prevent putting you on a statin. So if we can do that early, but at the same time, if you have a calcium score that comes back elevated, maybe a statin is worth the risk of, the risks of the statin that people freak out about. Statin is a great drug though. And I do believe for primary prevention, it is effective, and it can be useful if you need it. but
Right.
not all my patients need it. And I don't want to, I want to be clear that I don't give statins to everyone. I limit it. And if I tell you need a statin, you probably need a statin.
Well, and I appreciate that. I'll give you a little story. So I am into fitness. I run long distances, marathons, ultra marathons, and I think it's about 10 years ago, I, do my periodic physical every year and had my cholesterol checked. It started going up higher and higher. I mean, it was in the 280s. And I was doing everything I thought possible, exercising, every day for a half hour to an hour. I was eating no processed foods. Only thing that I was eating that was different than a plant-based diet. At that time, I wasn't plant-based. I was having chicken twice a day. And that was the only thing. And so I went through that cardiac calcium score. So I'm familiar with a lot of the tests that you said. Luckily, it wasn't, is it zero? But my cholesterol levels were still high. And I have the genetic history. My dad, his cholesterol's got into the 500s. And he tried statin. So I know it works for a group of people. For him, it didn't work because of it had, repercussions on his liver. And so he had to switch to I believe another medication. I can't remember what it was, but to help him. But that was actually after he had a near heart attack and a blockage, and he had to have a stent placed. And so it was right that happened. And then my cholesterol kept going higher. And I said, you know what? I really don't want to go on statins just because I feel side effects of stuff. And I figured if he had liver issues with the statins, there's a high chance that I would too. So I actually that was the reason why I went plant-based. And it was a big shift for me because I loved having chicken. I loved an occasional egg or turkey, for the holidays. So it was a big shift for me. And within a couple months, my cholesterol has dropped down into the 190s and have dropped down since then. It was like, for some reason, my genetics do not favor having animal-based products in my body. I know everyone's genetics are different in terms of what they eat in their diet and how their body responds, but I understand that there are times when statins and other medications are actually needed, and I appreciate that you try other methods first before going to those medications that sometimes they are needed, or sometimes people need it while they make other lifestyle changes to help them bring it back off. So I appreciate that.
Absolutely.
Yeah. So, go ahead. Sorry.
Oh, I was just going to say, and sometimes statins aren't effective. Like you said, it wasn't effective for your father.
Yeah.
So
Yeah.
there are other classes of medications, and that's where monitoring come in. Don't just put your patient on a statin and see in a year. We'll check your numbers again. You need to evaluate and follow up and ensure that the statin that you're giving is effective. Otherwise, we might need to try other things, because these drugs all work off of certain areas of the body and have certain mechanisms. And maybe your problem isn't what a statin fixes. So
Yeah.
absolutely.
We have several people watching, and one lady, I'm gonna put on here. I think you just kicked her Dr. Pepper habit. So I appreciate anything we can do to get people off soda. I know how that can be a little bit hard on our bodies. So
Absolutely.
let's kind of go into obesity a little bit, if you don't mind, and
Mm-hmm.
maybe just kind of talk about that. I know there's so many components to obesity, and how that makes it harder for us to handle some of the things that we get afflicted with, different viruses and flus and bacteria. Like, what is it about obesity that is so
Sure.
hard on us?
Well, obesity is something that kind of happens over time, obviously, right? It's something that's insidious, and it slowly builds to the point where one day we wake up and we look at ourselves and go, wow, what happened? I don't look like I used to look 10 years ago. And it is an insidious process in the sense that, it's not that one Dr. Pepper, for example, that really makes that big of a difference. But, a Dr. Pepper a day for 10 years can certainly have an impact on the total amount of calories and therefore your weight. I'd like to use one a patient that I've had. I've actually had quite a few patients like this, where they come to me because I do focus a lot on men's hormones, and they felt, they had some issues with fatigue and things like that they were questioning whether their testosterone was where it should be at. And, we do the lab test, and as expected, we have lower testosterone in these patients. But and this is kind of where I feel like naturopathic medicine and integrative medicine really shines, is that we're searching for the reason for it, right? Not just, oh, your testosterone's low, here's some testosterone. What we found was, because this individual was obese, and because of some of the questions that were asked during the new patient appointment, we determined that it actually might be something else going on. It might be sleep apnea. Sleep apnea is something that is very common in obese individuals. In fact, in men with neck size above 17 and a half and women above 16 and a half inch neck circumference, you're about 95% to have likely to have some sort of sleep apnea. When you're obese, you have more tissue and more weight on the neck. So when you're lying down, that's just more pressure and more tissue just pushing down and preventing breathing. That means you're not getting good sleep. When you're not getting good sleep, your body isn't functioning well, right? Most of our hormones are actually created at night. It included growth hormone and testosterone. So maybe for this individual, we determined that yes, his testosterone was low, and maybe we need to give it to him so he can better exercise and lose that fatigue and be there for his family, that type of thing. But the goal was not to keep him on testosterone forever. It was to figure out his sleep apnea, have him lose some weight. Because as that tissue disappears, as it goes away, you have improvement with your symptoms of sleep apnea, and that can help your sleep. Helping your sleep helps your hormones.
Interesting.
So it's sometimes it's this long trail that we kind of got to follow back, and it's not just a replacement of these hormones. It's finding other solutions and the root cause and the reason for your symptoms. As far as your question goes, is with corona and things like that, our immune systems need the same thing. We need to be able to take in healthy food so that our immune system, which 70% is actually stored in our gut, isn't dealing with a bunch of inflammatory foods and things like that. We need to get our 8 hours of sleep, because our bodies heal and fix and repair ourselves when we're sleeping. So a full 8 hours. People think, oh, I only need 5 or 6 and I'm fine. There's a great book by Matthew Walker called Why We Sleep. And he's been a sleep study expert for 20 plus years. And it is a fantastic book that shows you all of the different things that can happen, as far as more likely to get cancer with less than, I think, 6 hours. I'm paraphrasing now from the book, yeah. But our immune systems are dramatically dampened. Our insulin sensitivity and our blood glucose can rise when we don't get a full 8 hours of sleep. So it can have a dramatic effect and kind of a snowball effect just from things like not getting enough sleep. So as far as the coronavirus, COVID-19, I feel like it's kind of a change in the public's perception of health, because before we were okay with drinking sodas and eating all the foods that we don't really care about, and then we just lose it before the summer for our bathing suits and things like that. But now we're showing that our weight, obesity, diabetes, cardiovascular disease, and age, those are all major impactors of your outcome when you obtain COVID-19. So we want to constantly be in a state of health so that our bodies are able to fight something off when it comes, whether it's corona, COVID-19, or whatever might be coming next year or years down the line. We want to be ready. And it is nice to think about that if I get in a healthy spot, that I don't have to worry as much as the average person, because I take care of my body.
Yeah. Yeah. We have real quick a question from one of our viewers. She's curious about butter and heavy cream and if they're healthy or not. Can you touch on that a little bit?
So this is tough, and especially because it's such a vague question. We need fats in our body. We need cholesterol to produce some of our hormones and things like that. Where we get those fats, there's many different types of fats. Typically, the ones that we need that we can't produce ourselves are going to be things like omega-3s and omega-6s. That's why we take fish oil, and we say that eating fish occasionally is healthy. I would not say butter is bad, but anything in too much of anything can be concerning. Obviously, too many calories leads to obesity, and like we talked about, just 10 minutes ago, obesity leads to risk factors of many things: cancer, cardiovascular disease, diabetes. So I don't think that butter is bad necessarily, and it can have its uses. When you add fats to meals, when you add butter to your coffee, for example, the bulletproof. I hope I don't get trademark infringement there, but when you add things like that to sugary substances, it actually slows the absorption, so they can be useful. Is something like avocado, more of a plant-based fat, going to be a little bit healthier for you than butter or heavy cream? Yeah, I would think so. But who's going to put avocado in their coffee, right? So,
hey, that could be a new thing. You never know. You better watch it.
I believe in moderation of all things. And one thing that I always tell my patients is it's not a cheat meal. It's an earned meal, because when you eat healthy for a week on Sunday night or whatever that it might be, I want you to indulge a little bit. One meal out of your week is not going to wreck your body. It's not going to destroy your diet. I mean, obviously there are some diets that if you're a ketogenic and you start eating a bunch of sugar, then yeah, it could wreck your diet, but it's easy to get back on track and things like that. The big thing is moderation. If you're eating butter every single day with heavy cream, it's very easy to overdo the calories and get less nutrient dense foods that have the vitamins and minerals that you need, that you're losing because now instead of vegetables, you're eating butter or whatnot. So I hope that answered your question.
I think that was great. Thank you. I appreciate that. Now, you have a practice here in Scottsdale, Arizona. And can you tell us a little bit about your practice in terms of the services you offer? What does it look like in terms of coming in for a first visit? What do you have virtual visits? Just some of those things so people can reach out to you.
Absolutely. So as you can see on the banner, we have victusintegrative.com. That's a great resource for finding out more about us. You can read the bios of me and my wife, Dr. Kimberlyn Mazzara. She also works at the practice. And then we also have Casey and Lizzie, who are our office staff, and they help us keep the practice running. They are very crucial. So essentially, a new patient visit is about an hour long, and that's longer than you would typically spend with a new physician. But it's needed. We're going to go over your history. We're going to go over any medications and supplements you're on. We're going to go over family history, things like that. If there's any testing that's needed, like we just talked about earlier with the familial dyslipidemia, maybe that's an issue that we didn't think was an issue. We're also going to do an in-depth physical exam. Typically, we're checking, the nervous system. We're checking lymph nodes and things, just seeing if there's anything abnormal. We do an abdominal exam typically. So just kind of evaluating many, many different areas. And then, like I said earlier, we also include some lab work in our new patient appointment. So we're checking your red blood cells, your white blood cells, your platelet count. We're checking your kidney function, liver function. We're also checking the hemoglobin A1C, which is the 3-month blood glucose average. That's kind of checking how you're doing as far as diabetes goes, if you're trending towards that. And then, like I said, the lipid panel, which we use to evaluate your risk of cardiovascular disease. So what I like to emphasize is that we're not just looking at what you come in for. Obviously, that's the priority, but we're all about your overall health. Because even if you come to us with a symptom that can be easily addressed, would it be better addressed if you had a healthier functioning body that would heal better and heal faster and things like that? So it is important to your treatment to get that all-inclusive visual of your health, right? See the big picture.
Right. Absolutely. And for those of you listening, take note of everything Dr. Lieske is saying, because this is what you want when you go and see someone. If you can't get to Phoenix to see him specifically, you want to make sure the person you are seeing is taking this holistic approach and they are going through everything, because sometimes we don't realize. I mean, you were mentioning testosterone, low levels in that, and it's related to sleep apnea. Well, if you go to someone and they're only looking at your testosterone levels and messing with that, you've missed that. Maybe it's part of obesity or sleep apnea or anything else. And so this type of approach is phenomenal because it looks at you as a whole person. Now, obviously, I would love for people to be able to come and see you in person. Now, let's say they live somewhere else and they are in town visiting. They can make an appointment with you. How
Absolutely.
about and then they see you, they get this comprehensive testing done, or if they're in the area, they can obviously go see you. But now for follow-up visits, they could do something more on a virtual basis, right?
Yeah, absolutely.
If needed.
We have the ability to do telemedicine. It is something that we like to see you in person simply because we do want that physical exam. We want to be able to evaluate you as best as possible, and do the blood work, right? We draw on site for your convenience and things like that. And we get the results back fairly quickly within a week. So then we can immediately get started on whatever treatment or whatever that's necessary for you. Right now with Corona happening and things like that, we're trying to do the social distancing thing, and we don't want our patients to be coming in if they don't have to. So we're happy to do Zoom calls or phone calls after we see you for the first time to go over your lab work and things like that. We do go line by line, so it is a little bit easier if you're in the area, because then we can actually go over the form right, together. But we're making, we're doing best practices that we can right now, wiping everything down, of course, and following above and beyond the CDC guidelines for healthcare practitioners to stay safe, to keep our patients safe.
Good. That's wonderful. I'm glad to hear that. Now, is there anything else you'd like to share about your practice? I mean, I know you have a lot to offer, so anything else?
Yeah, I'm sorry. I don't think I even finished your last
Oh,
question where you asked me to describe all the things that we do.
yeah.
So we do focus on hormones and metabolic health, which I know we've kind of hit on, and that's men and women's hormones, estrogens, progesterone, thyroid. Thyroid isn't really seen as a hormone to most people, but it is. These are hormones that come out of a different gland in your neck, and it's a big factor in obesity and things like that. Fatigue, hair loss, those types of symptoms are something we typically and very commonly see. With thyroid, also you have adrenal glands. These produce a lot of different hormones. So we can check all of those. We do all the blood draws on site. So our big thing is convenience, speed of care, things like that. We also do procedures. So I do have a small passion for sports medicine. So doing things like trigger points, we do PRP injections, prolotherapy injections, things like that for tissue repair. My wife is focused a little bit more on the female side of things. So for aesthetics, things like that. So PRP, which is platelet-rich plasma, she does the PRP facials with microneedling along with hair restoration. And that can be great for bringing back some of that hair follicles using platelet-rich plasma.
Oh,
So that's pretty much essentially all that we do. We do primary care for our patients that want it, but it's really not our focus and our passion. And like I said, right now we're really diving into the prevention side of metabolic health, because people they need it right now. They want to feel safe in the Corona-19 epidemic or pandemic that we have going on right now. So we want to ensure that they're in a good spot. And sometimes people come to us because they're worried about their cholesterol, and we find out it's actually something going on with your hormones. So it goes both ways. No matter how you get to us, we're going to ask you a bunch of questions and try and figure out what's going on and figure out the best plan for you.
Yeah, that's wonderful. And we are going to be lucky enough, we get to talk to your wife next week on next Sunday. And so we'll have some topics to discuss with her about vitamins and other things. So it'll be great to get to meet her and share some information on her side as well. Now, if people have more comments or questions that they want to ask of you, would you like them to go to your website, victusintegrative.com, and then can they reach you through there?
Yes, they can absolutely reach us through there. There's different areas at the very bottom of any of our web pages. You'll see a little contact box that you can email us. Email us at info@victusintegrative.com. So those are the best ways to get a hold of us, or just call our office.
Yes. And I'm sure many people need your services, and especially now when we're trying to learn more about health and wellness and what we can do to take care of ourselves and have more control over how we feel. Reaching out to someone like you is an absolute must. So I really appreciate your time here today and talking to our audience, because I know they really benefited from it, and just really appreciate your time. So
awesome.
Thank you.
Well, thank you so much for having me. I really appreciate it.
Okay. And have a wonderful rest of your weekend. Everyone out there, please watch this over and over again. Get some information from Dr. Lieske, and please reach out to him. He is a wealth of knowledge, and I'm sure I learned some stuff, so I'm sure all of you guys learned some stuff from him, and he's a great resource and a great person to have on your healthcare team to improve your health, whether you're in the Phoenix area or outside of the Phoenix area. This is a good person to have on your team. So thank you for joining us today, and we will see you again next week. Bye.
Thanks, guys. Bye.